to everybody. I'm Dr. Selvaraj. I'm a freelance interventional cardiologist practicing in Coimbataro in RS area. I've been in practice in cardiology for almost 20 years now. And I'm visiting two hospitals where I do my regular invasive and interventional, Coimbataro Hospital and KMCH City Center. And I see my patients in my clinic regularly where I perform all non-invasive tests like echocardiography and stress testing and my regular clinic consultations session there. I mean, I see patients regularly in my clinic with heart failure problem. They often ask me what is wrong with them, especially when they have breathing difficulty or unexplained fatigue or pedal edema. I don't tell them straight away, and I don't avoid using the term heart failure because they may be upset by the statement. Basically, heart failure is the inability of the heart to pump as efficiently as it should. That's in layman's terms. It is a pathophysiological state in which the heart is unable to pump blood at a rate commensurate with the requirement of metabolizing tissues and can do so only at the expense of an abnormally elevated diastolic volume and diastolic pressure, which will be detrimental in the long run. Major symptoms of heart failure are severe tiredness or fatigue, breathlessness, and swelling of the ankles and feet. How common is heart failure? Heart failure is said to affect about 1 to 2% of adult population in India approximately. The Framingham Heart Study, a community-based study in Massachusetts in the United States in the late 1940s, was carried out over a period of 40 years, has shown that the incidence of heart failure increases steeply with age from 3 per thousand per year in men between 50 and 59 to 27 per thousand in men between 80 to 89 years, with a slightly lower rate in women. Okay. There are specific patient group who are at risk of developing heart failure. People with coronary artery disease, which in my opinion is the most common cause of heart failure. And people with long-standing or uncontrolled hypertension or diabetes, or people with valvular heart disease, and those with primary heart muscle disease such as dilated hypertrophic or restrictive cardiomyopathy, and those with congenital cardiac defects. Early recognition of symptoms of heart failure is clearly important. Symptoms such as excessive tiredness, breathlessness, and swelling around the ankles. Symptoms may develop suddenly as a result of an acute heart attack or may develop slowly over weeks or even months. When heart failure is a serious condition with increased morbidity, by which I mean requiring repeated hospitalization, and in certain situations can be life-threatening. The condition is, however, manageable with lifestyle changes, optimal medical therapy, and advanced therapies. How can heart failure be managed and treated effectively? Significant progress has been made in recent years in terms of newer drugs for heart failure. Device-based therapies to help patients to lead a fairly comfortable life. And there are also surgical options such as coronary revascularization in patients with hibernating myocardium with either PCI or CABG. In some cases of heart failure due to valvular heart disease, valve repair or replacement may be helpful. And cardiac transplant is in selected cases may be a good option, but it's only possible in selected cases because of the lack of donor hearts. And heart failure is basically is easily manageable with optimal medical therapy and lifestyle changes, such as salt restriction, smoking cessation, cutting down or stopping drinking alcohol, and modest regular exercise and stress reduction as well. Always have a positive outlook in life. Keep yourself well informed about a new treatment in heart failure. It makes good sense to do everything possible to limit heart failure progression. Regular visits to a cardiologist is important to monitor progress. It is the responsibility of the cardiologist not only to identify the underlying cause of heart failure, but also to identify the precipitating cause as heart failure. In most cases, is a chronic condition with frequent exacerbations requiring adjustments in medical therapy. Precipitating causes should be sought for, such as infection, because a congested lung is a risk factor for pulmonary infection, anemia, hyperdynamic status such as thyrotoxicosis and pregnancy, infarction or uncontrolled ischemia, uncontrolled hypertension are some of the precipitating risk factors I look for when I see patients with heart failure who show signs of relapses. When I would advise them to watch for symptoms of heart failure, such as excessive tiredness, breathlessness, and swelling around the ankles and feet. If you are a hypertensive or a diabetic or suffered a heart attack recently, and consult your doctor for evaluation. If you tell your doctor about the symptoms, he or she may suspect heart failure and breathlessness. And breathlessness and edema around ankles are not always due to heart failure. Sometimes it is difficult to differentiate a cardiac cause of breathlessness from non-cardiac causes, such as obesity or if they have respiratory problems. In such cases, the doctor will take a comprehensive history to do whether the breathlessness is cardiac or respiratory. Some patients may have a combination of both as well. And during examination, we look for heart rate and rhythm to see whether there is a precipitating cause, such as an arrhythmia. Check the blood pressure, or look for any cardiac murmurs, and look for signs of fluid overload, such as basal crepitations, pedal edema, and raised jugular venous pressure. And if there is a strong suspicion, we always do blood tests to rule out anemia, renal functions, and thyroid disorder. We do an ECG to rule out an infarct or ischemia or rhythm disturbance, a chest X-ray looking for cardiomegaly and pulmonary congestion. And echocardiography is a wonderful tool which may help to identify the underlying cause for heart failure and to assess left ventricular ejection fraction. And there is also a condition called ejection fraction with preserved, left ventricular failure with preserved ejection fraction. And in some cases, coronary angiography or a myocardial perfusion imaging may be useful in special cases. And based on that, you will be advised on lifestyle changes, optimal medical therapy.